presented by vetcity.com. I'm Virginie Barberet, your radiologist on demand for this week. Today's example is a 3-year-old boxer that has been coughing for 2 weeks. The cough has worsened in the past 2 days and developed while the dog was already on antibiotics for urinary tract infection. CBC demonstrated eosinophilia and the dog had received 3 doses of fenbendazole. We are presented with a set of 3 thoracic radiographs. So let's look at the important findings on those radiographs. First, we can see the moderate diffuse bronchial pattern. It appears as multiple tram lines that we can see here or here. You can follow the bronchial walls that are thickened. So those are called tram lines. But they also appear as some rings that we can see here, for example, which are the bronchi in cross-section, and we see the bronchial walls being thickened. The second important findings on those radiographs is the presence of other pulmonary patterns. There is a diffuse interstitial pattern, which is more pronounced in the caudal dorsal lung field, and you can see it as a diffuse increase in soft tissue opacity, and it appears as peribronchial cuffing, so we can see the bronchial rings that are quite thick at some levels, and that's due to the interstitium around the bronchi being thicker. There is also a focal alveolar pattern, which is present in the ventral aspect of the right cranial lung lobe, so best seen on the left lateral projection, where we can see here the increased soft tissue opacity and some ill-defined air bronchograms. So there is also some transient dilation of the esophagus with gas, but this is only seen in one projection, so it's probably incidental. So as a conclusion, we have a diffuse moderate bronchial pattern associated with some interstitial pattern and a bit of alveolar pattern. So we have a mixed pattern. The main differential diagnosis in this case is eosinophilic bronchopneumonopathy, because the dog presented eosinophilia on blood tests, but also because the dog hasn't responded to antibiotics treatment or antiparasitic treatment. Because the other causes for a diffuse bronchointerstitial pattern, tending to be alveolar at some levels, could be also bacterial or parasitic pneumonias, bronchopneumonias, but in that case, because of the lack of response with the treatment and the eosinophilia on the blood, and eosinophilic bronchopneumonopathy would be considered more likely. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your question on social media.